Marcin, would you like to begin with the usual disclaimer, and then we'll go from there?
Yes, Mr. Chair. This meeting is being recorded for the minute-taking purposes, as well as for posting of the recording on the agency's website. This meeting is also being live-streamed on the Access Health CT website. Connecticut Television Network is also recording this meeting for a later broadcast. Thank you. Thank you, Mr. Chair.
Thanks very much. Let's begin with the roll call of the directors present. This is Charles Klippel. Good morning.
Morning. Paul Philpott, Vice Chair.
Here.
Thank you. Grant Ritter.
Here.
Thank you. Deidre Gifford. Steven Hernandez. Matthew Brockman.
Here.
Thank you. Thomas McNeil.
Here.
Dina Berlin.
Here.
Thank you. Andrea Barton Reeves, DSS Commissioner. Kathleen Holt from OHA.
I'm here. Thank you.
Thank you. Claudia Gualtieri from OPM.
Here.
Thank you. Paul Lombardo from Connecticut Insurance Department.
Here.
Thank you. Manisha Jutani, DPH Commissioner. And Caroline Zambetti, designee for Nancy Navarrete, DMS Commissioner.
Here.
Thank you.
Thank you all. And again, good morning. If I could ask the leadership team to introduce themselves.
Good morning, all. James Michelle, Access Health Connecticut.
Good morning, everyone. Gina Walsh, Director of Operations, Access Health CT.
Good morning, everyone. Holly Zwick, Director of Finance, Access Health CT.
Hi, good morning. Rebecca McClear, Director of Technical Operations and Access Health CT.
Good morning, everyone. Susan Rich Bai, Director of Legal and Governmental Affairs, Access Health Connecticut.
And good morning, Caroline Roulette, Director of Marketing, Access Health CT.
Good morning, everybody. John Carbone, Director of Small Group Product Development and Broker Support at Access Health Connecticut.
Good morning, everyone. Glenn Jurgen, Director of Human Resources, Access Health CT.
Marquise Davis, Director of IT, Access Health Connecticut.
All right.
Mr. Chair, this concludes the SLT announcements.
Terrific. Thank you very much. We actually have a public comment today. It's a slightly lengthy one, but I will read it, and then we'll ask James perhaps to have a quick comment to it. It's in the form of a letter from Deb Poland, who's the Chief Strategy Officer of the Community Health Center Association of Connecticut. And she writes, "Good morning, everyone. I regret that I'm not available to provide these comments during the meeting, but I wanted to take the opportunity to share some of the feedback we're hearing from the community health centers over the first few weeks of open enrollment. As you know, CHC ACT works with the state's community health centers, which provide medical, dental, and behavioral health care to 440,000 people across the state each year. CHC ACT and Connecticut's health centers have been privileged partner of Access Health Connecticut since its inception, with dozens of health center staff serving as certified application counselors, CACs, each year. CACs help thousands in the state residents enroll in Access Health Connecticut, Covered Connecticut, or Husky. Many CACs have numerous years of tenure, including several who have been providing services to Access Health Connecticut clients since 2013. CACs are trained and certified by Access Health Connecticut annually. During open enrollment each year, CHC ACT hosts regular check-ins with the CACs and liaises with dedicated Access Health Connecticut staff who work to resolve issues. Some of these issues are individualized, while some are system-wide. Today, I want to share some ground-level feedback with the Access Health Connecticut Board of Directors regarding the first few weeks of open enrollment. She then provides some bullet points. The first one is call center waiting times are excessive this year, with many dropped calls. CACs report that over the past 2 weeks, wait times have averaged approximately 40 minutes. Additionally, they report many dropped calls, including the middle of an application, resulting in the CAC having to call back and get back online. The dropped call issue was reported across the board and also specifically for clients needing Portuguese or Haitian Creole translations. Second bullet, call center representatives do not allow a CAC to speak on behalf of their client if this is an initial application. This means that the CAC, who has been trained and certified by Active Health Connecticut, sits in the background, is not allowed to speak on behalf of or otherwise assist the customer. Even if the customer agrees to allow the CAC to assist, the CAC cannot, even though language or comprehension issues. The CAC is trusted advisor to the customer, but cannot advise. This leads to errors in the application, particularly if there are language barriers and longer calls impacting enrollment for client and the wait times for everyone else. This apparently is not a new policy, but it has been problematic over the years. Please consider changing this policy and allowing CACs to fully assist their clients. Third bullet, call center representatives unnecessarily create a new account. When a CAC starts to create an account but is unable to verify the identity of the customer, she calls the call center to assist with this piece. Sometimes the call center representative will instead create a brand new account for the customer, resulting in there being two separate accounts. This leads to problems down the line. Fourth bullet, customer portal is volatile. CACs report being kicked out of the customer portal in the middle of an application. Other times, the portal is simply out of service. Again, I want to express my gratitude to Access Health Connecticut for our longstanding partnership. Together, CHC ACT, Community Health Centers, and Access Health CT are helping hundreds of thousands of Connecticut residents access health care. I am confident that these issues can be resolved, and I am happy to provide additional information to assist toward this goal. Please reach out to me with any questions, and she provides her contact information. That's her comment to us today. And James, perhaps I would ask you to respond to this comment.
Thank you, Mr. Chairman. First and foremost, Dev Poland has been a trusted partner of ours in the entire CAC community across Connecticut. Very helpful to us in enrolling folks in both Connecticut, Access Health products as well as Husky products. Let me very quickly talk about each of the items that she mentioned. The call center, for the first week, the call center was a challenge for us. And the average wait time was around 20, a little bit more than 20 minutes. Some folks may have experienced a longer time than some others, but the average was about 20 minutes. Once this came to my attention, and myself and Gina Walsh, Director of Operations, we got on the phone with the call center senior management, and we started addressing this, and they put together a strategy. Now, the call center, the following weeks, the wait time was down to 4 minutes. And yesterday was down to under a minute. So we are addressing the call center. That's a real issue for us every year. The first couple of weeks is always a challenge because they have staffing challenges, meaning that typically the turnover rate, they go through the whole process of training folks and people don't show up the first day of open enrollment. And also they're brand new. So there are some challenges to get them going. So again, they've been working very closely with that. One of the reasons that the wait time has gone down is because more CSCs are coming online than compared to the first 2 weeks. So we are moving in the right direction to address that. With respect to call center representatives do not allow CSC to speak on behalf of their client, we're not quite sure exactly where that's coming, because our policy is that as long as the CAC is authorized by the applicant on the phone, they are free to speak with our call center reps directly on behalf of the applicant. That's been our policy since we've been around. So so we're gonna follow up with that one. Review some recordings of some of our call centers, and we've also asked Deb to give us some specific examples of those instances happening, so we could follow up And so if we need to retrain some of our CSCs, we will do that. But yeah, again, we did talk with Deb Pullen yesterday. She didn't have any specific examples, so we're going to follow up with her, get some specific examples of where, if she could pinpoint when it happened from some of her constituents, and then we will follow up. And everything we do on the call center is recorded in detail, so we could go back and check to see exactly what happened. With the call center representative unnecessarily create new accounts, again, that is new to us as well because they are not allowed to do it. In some instances, our system will not allow you to create a new account for somebody who is already in the system. It gives you a soft stop and sometimes gives you a hard stop. So we've asked for some examples of where that has happened so we could go back and look at it and dig into our system and see, is there a glitch in our system or is it just plain miscommunication between her and her folks? And finally, the customer portal is volatile. We've gone back, Rebecca and her team have gone back and looked at our system since we went live. Our system has been rock solid. It's been, again, we monitor our system and the call center performance every day during open enrollment. So if there are any issues, we know about it very quickly and we address it immediately and we communicate it to all of our partners that we're having an issue. But we have not had any type of issues with our customer portal since we went live. Again, we're gonna meet with Deb as soon as she's back in town and get some examples of specific areas examples of each of these areas so we could see whether or not it's our system or it's the communication. But we do know that our system has been functioning as designed. But we do know that our system is, again, that's why we have the 10 Clicks project. We know our system takes a lot longer than the person should have go through to apply for health insurance. Again, expectations over the last 10 years have improved dramatically in terms of customers coming to us. They expect us to be like other websites that have improved over the last 10 years. Unfortunately, our system we have not been any market improvement to our system since we went live over 12 years ago. We are still using the same technology that we used 10 years ago. So that's why we are working hard to develop a project plan to address that, and hence the 10 Clicks project. So more to come on that. So, Mr. Chairman, we are very thankful for Deb and her team's continued support of us and also the people that they're serving across the state of Connecticut. We'll work very diligently with her to address our concerns and get more information and dig into our system, see if there's a glitch in our system or is our folks are not trained properly, then we'll retrain them. But communication is the key to resolve these issues, and we'll continue to communicate with Deb and her team to address any concerns that they have.
James, thank you. Are there any other comments or questions regarding this comment? If not, then James, if you would be kind enough to check in with her. Oh, sorry.
Mr. Chair, I'm not sure if we saw the written comments, but if it's possible to share by way of follow-up with all board members, the written statement, I think it would be helpful.
Sure,
yeah,
Marcel.
We have Martians forwarded to you. We have Martian forward the entire document to the entire board.
Thank you, James.
Yes, sir.
So I would ask James that you follow up with her. Of course, you're doing that already, and yes. Later in the enrollment cycle, come back to us and sort of give us a little bit of an update on how that's gone.
Will do so.
Appreciate that. Thank you. Thank you very much. Next item, being no further comments, is to approve the minutes of the last meeting. Do I have any comments on the minutes of the last meeting? If no comments, then I'd ask for a motion to approve the minutes of the last meeting.
This is Claudio, so moved, Mr. Chair.
Thanks, Claudio. Second?
Seconded, Grant.
Thank you, Grant. This is Charles Clipple. Actually, I was not at the last meeting, so I abstain, but Marson, if you take a vote.
So there's obviously there's no comments regarding the motion
Oh,
before us, right?
I sorry, I heard no comments. If there are any comments, please. If not, Marson.
Okay, Chair Sklippel.
I was not present at the last meeting, so abstain.
Okay, thank you. Paul Philpott.
Yes.
Thank you. Grant Ritter.
Yes.
Deidre Gifford. Steven Hernandez. Matthew Brockman.
Yes.
Thomas McNeil.
Yes.
Dina Berlin.
Yes.
Andrea Barton Reeves.
Yes.
Kathleen Holt. Okay, thank you. Thank you. And Claudio Gualtieri.
Yes.
Thank you.
Thank you all very much. James, I believe the floor is yours.
Thank you very much. I have a very quick comment. Good morning, all. Again, I'm James Michelle, Chief Executive Officer of Access Health Connecticut. Thank you for joining us this morning. Before we begin the presentation, I have a few progress updates for the board. I'm happy to report that the November soft launch of the Individual Coverage Health Reimbursement Agreement, also known as ICHRA, went well. We continue to see positive performance on the platform. We conducted demonstrations of the platform for one of our carriers last month, and we're doing the other one this afternoon. We have also been getting a lot of helpful feedback from the brokers that are currently trying to break the system, give us feedback so we could update the system accordingly. So we are doing weekly updates to our system to make it more efficient, make it slicker, and but more importantly, make it user-friendly for the brokers, the employees, as well as the employers. I also want to share that we are continuing to develop our strategy around the 10 Clicks project. This is, again, to improve our system so that it's easier, more efficient, and faster for Connecticut residents to apply for health insurance through Access Health, as well as the call center and our employees to be able to use our system to efficiently address issues that, one of them came up into during the comments earlier this morning. And finally, I want to make the board aware that we are in the final stage of awarding, procuring a new call center vendor. Right, and the process started back in early summer, and we had a number of respondents, and we've evaluated all of them, and we brought it down to 2 that came in for oral presentations, and our team have decided on which one they want to go with, and that'll be awarded very shortly. Regarding the intent is to have them start in late spring, early summer, in preparation for the next open enrollment. Regarding today's meeting, we will begin with an update from Holly Zwick. She will update the board on fiscal year 2024 year-end numbers, as well as the first quarter for FY 2025. After that, Katie Hearns, Associate Director of Enterprise Project Management, EPMO, will give an update on the open enrollment 12 update. And she will be followed by Susan Rich-Bai, Director of Legal and Government Affairs. Susan will give an update on the fiscal year 2024 financial and programmatic audits, as well as the state-based marketplace annual reporting tool. Mr. Chairman, this concludes my brief update for the board. I welcome any questions.
Thank you, James. Are there any questions? Terrific. Okay, if not, then thank you again, and we'll ask Holly to provide the financial update.
Good morning, everyone. I'm Holly Zwick, Director of Finance, Access Health CG. Thank you, Chairman Klippel and members of the board. Today, as James mentioned, I will be speaking about the fiscal year 24 budget report, fiscal year 25 quarter 1 budget, and the proposed reserve policy. This slide here portrays the fiscal year 24 budget versus actual summary. Access Health closed fiscal year 24 approximately $166,000 under budget. Our shared budget with DSS for fiscal year 24 closed at about $2.3 million over budget, and I'll go into more detail on the next slide. Now, in more detail, we finished the last fiscal year, 2024, over budget on the revenue side due to increased interest rates over the past 12 months and assessment revenue higher than projected, due in part to higher than anticipated dental assessments. On the expense side, we closed fiscal year 24 approximately $166,000 under budget overall, as I mentioned earlier. To highlight a few items, temporary staffing came in over budget to pay for assistance with network support and IRS CMS changes to compliance requirements. Our largest variance in savings can be seen in the contractual line item, which came in close to $622,000 under budget due to a lower call volume proportion of QHP versus Medicaid calls due to Medicaid unwind. Equipment and maintenance also came in under budget due to savings on system maintenance. Our largest over budget variance was in the IT enhancements area, which closed roughly $778,000 over budget for additional IT system enhancement projects involving regulatory changes, along with updates to better our system. For example, enhancing broker capabilities to manage their client lists and more, and initiatives such as the DRS Check the Box initiative. Our shared budget with DSS for fiscal year 24 closed at approximately $2.3 million over budget, as stated earlier. Next slide, please. This slide brings us to the investment report, which we need to revisit every 6 months. To briefly recap, the objective for Access Health CT exchange funds is to obtain the maximum rate of return while preserving the principal and providing immediate liquidity. Access Health invests in the State of Connecticut Treasurer Short-Term Investment Fund, also known as STIF. The year-to-date earnings as of September 30th, 2024 on the STIF account is $335,595. This is an average of over $110,000 monthly for the last 3 months. Interest rates are on a decline, however, and we must anticipate revenue on the interest in the STIF account may very well decrease moving forward. Next slide, please. The fiscal year 25 quarter one budget is focused on investments in IT, cybersecurity, and health disparities to aid in supporting our mission of decreasing the number of uninsured residents, improving the quality of healthcare, and reducing health disparities. Next slide, please. Here you can see the fiscal year 25 year-to-date budget versus actual summary. Our Access Health budget is $546,940 over budget at the end of the first quarter of fiscal year 25. This is due to the timing of projects, as we occasionally have the opportunity to start projects early. The DSS shared cost budget at the end of quarter one is roughly $382,000 under budget, also due to the timing of expenses and projects. Next slide, please. This slide portrays the fiscal year 25 budget versus actuals for quarter one in detail. As I mentioned previously, interest income is over budget along with market assessments. On the expense side, the multiple variances are due to the timing of projects and invoices, as I stated in a previous slide. Some of the projects we started in quarter one are moving faster than anticipated, and we needed to spend money earlier. Next slide, please. At this point, we are not anticipating any changes to the current proposed budget as of the first quarter of fiscal year 25. Thank you, Marcine. This slide shows the breakdown of the full fiscal year 25 budget after quarter one. Once again, we are not anticipating any changes to this budget, but if any changes become necessary, we will come back to the board and finance committee to approve any changes and/or spending amounts. Next slide, please. In addition, we are not anticipating any changes to the shared cost budget with DSS currently. Next slide, please. I'd like to speak briefly about our reserve fund balance. At this time, our fiscal year 25 year-end reserve balance is projected at $18.5 million, approximately, which based on the fiscal year 25 budget would cover 6 months of operating funding. As you recall, the board approved a $2.7 million withdrawal to support Medicaid unwinding the marketing and outreach for the Medicaid unwinding in fiscal year 23, which was paid out in fiscal year 24. Based on experience, investment performance and savings achieved throughout the year, along with the potential for higher billing for assessments, all point to an anticipated surplus between $500,000 and $1 million conservatively at the end of fiscal year 25. But as everyone knows, it's too early in the fiscal year to tell.
Harley, very quickly, let me make one quick comment about the $2.7 million that the board authorized us to take out of reserve to support marketing and outreach for Medicaid Unwind. The marketing team, they're going through all the data on how we spent that money and the impact that may have had. So we do have a report that we are working on for the board. We will share with you at the next board meeting, which will be in January. We may send you a report, the drafted report before then, but it'll detail how we spent that money, where we spent it, more importantly, the impact that had in terms of outreach, direct marketing to consumer, direct marketing to consumers, and also the benefit or the results of those outreach that we had. So I think that you'll be hopefully be impressed with the result, the impact that that $2.7 million investment had in the Connecticut residents to come in, and especially as they were losing Medicaid. So more to come on that. Very detailed report, and the marketing teams put together for the board to see how the money was spent, and more importantly, how it benefited the Connecticut residents.
Thank you for explaining that, James. Let's see. On next slide, Marcine, I think it may be a vote. Yes.
Thank you very much, Holly. Let me first ask for questions or comments about your presentation and about the budget items that you presented.
Certainly.
Grant?
Yes, hi. Could you tell me what is the recommended number of months of operating funding that the industry basically has hit on? And do we have a plan to sort of increase from 6.0? That seems to be pretty much on the low side, I think, back up to something a little higher.
So, Grant, we do have an item coming up, reserve policy, and we address both of those questions you asked.
Okay,
so
fine.
If you don't mind waiting, we'll deal with it shortly.
That's fine. Thanks.
Thank you.
Thank you.
Grant, for a second, I thought that James had planted you in the audience. That was a perfect segue for our next item. So, thank you.
It really was.
Any other plans? I'm sorry, any other comments? Hearing no other comments, then we reached the vote. I'm actually slightly curious as to the vote here, because you're proposing no deviations from the budget we've already approved. So I take it that we are voting to approve the first quarter budget, which it seems to be entirely in line with what we expected. Is that, have I got this correct?
Susan, you want to comment on that, Susan? Why do we need to vote at this point?
Thank you. Yeah, we always present quarterly budget reports to the board. Sometimes there are movements within lines slightly, so I would turn it over to Holly. I guess if there are no movements, it's just a practice that we always have done so that the board has visibility into, the budget throughout the year. And any changes that may come up.
I don't have any concern with voting on it. It's just, it seems like it should be a fairly straightforward vote, because you're not proposing that we make any deviations from the budget we've already approved. So let's do it just for formality's sake. And again, I would ask if there are any comments. If not, then I would ask for a vote to approve the fiscal 2025 Q1 budget. And this is, I need a nomination, I guess, for that.
A motion.
So moved.
Chair.
Thank you. And a second?
Don McNeil, second.
Thank you,
Okay.
Tom. Again, any comment? If not, then Charles Klippel, yes.
Okay. Paul Philpott,
Yes.
Grant Ritter,
Yes.
Deidre Gifford, Steve Hernandez.
I'm here, Martin. I'm going to
Thank you.
abstain because I missed the discussion.
Thank you, Dr. Gifford. Steve Hernandez.
Aye.
Matthew Brackman,
Yes.
Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves, Kathleen Holt,
Yes.
and Claudia Gualtieri.
Yes.
Thank you.
Holly, thank you for making our lives easy there.
You're welcome.
The next issue is a discussion of the proposed reserve policy.
Yes, thank you so much. Holly Zwick, Director of Finance, Access Health. I'm going to take a moment to walk you through the evolution of the reserve policy here at Access Health CT. Back in April of 2023, the Access Health Board suggested that we formalize a reserve policy. And in June, we presented research, June of 23, we presented research on the reserves of other state-based exchanges and quasi-public agencies. We found in brief that 3 other exchanges had between 6 and 15 months of unrestricted reserves, while 1 quasi-public agency had a reserve of 25 months. Then this past November of 23, we presented the Finance Committee with additional research, including data on the reserves of Connecticut nonprofits. And finally, this past April, we presented to the committee a draft of the reserve fund policy based on this research. And we added some more research as well, such as the estimated cost of a cybersecurity attack. So to try to see what we should have in our reserves. Next slide, please. The proposed reserve fund policy will determine the target reserve amount as well as the intended use of the reserves. We have taken your suggestions from our last meeting and added that we would revisit the target amount of the reserves at least every 3 years. To review the major points set forth in the proposed reserve policy, the designated funds are set aside by the board. We would like to target 9 months of operating funds, which would equate to approximately $27.8 million for fiscal year 25. The funds are to be used when there is an unanticipated loss of funding, for one-time unbudgeted expenses, whether an emergency or for the implementation of a strategic initiative, and for sudden increases in expenses. A request to utilize reserve funds will be approved by the Access Health Finance Committee and Board of Directors. And finally, we also spelled out how the calculation for the reserves is based on the fiscal year budget, not the calendar year. I also, because of Mr. Ritter's, Board Member Ritter's question, wanted to add that one of our organizational goals this year, our department goals for finance to support an organizational access health goal, is to increase the reserves. So yes, we do believe 6 months may be on the low side and will remain a goal until we're at a point, you know, that everyone finds sufficient. That concludes my reserve fund policy statement. Does anyone have any questions?
Very quickly, Grant, to answer your question about how we're going to build the reserves, we're going to be very efficient in spending the expense part of the budget. So any savings achieved there will be will go into reserves. We're also going to ramp up our efforts in going after grant money. All right, and a lot of grant money will hopefully absorb some of the costs we currently have, and so any excess grant money will go into reserves. And we're also going to be we've been very aggressive at going after pursuing billing for assessment dollars. So we have a team in finance that they do all the calculations, working with CID and CMS to get all the information we need to ensure that we maximize our revenues through assessments. And we're also anticipating over the next several years, because of the increased enrollment in QHP, we anticipate over the next several years, we will have additional revenue from assessment simply because of more premium dollars will be available for us to assess. And in particularly the enhanced subsidies have really been helpful for Connecticut residents to maintain their health insurance. And Cover Connecticut has been extraordinarily helpful in helping people to hold on to their insurance. And because most of the insurance has been, most of the premium, the entire premium has been funded by subsidies from the federal government as well as state of Connecticut. So again, that's going to help us to have a bigger base to assess going forward. So we think between savings, being an elevated amount of premiums to assess, as well as pursuing grant money, we can achieve the 9 months over the next 3 to 5 years.
So James, the glide path is that it's sort of try to get to this number in 3 to 5 years?
But that's our goal.
Okay. Any further discussion on this policy? If not, then I believe we are being asked to vote on approving this policy. Policy being to work toward a 9% or a 9-month reserve position for the organization. Can I have a motion to approve that policy?
Mr. Chair, this is Claudio. I will make a motion to accept the reserve policy as presented.
Thank you, Claudio. Could I have a second?
McNeil, second.
Second.
Tom, thank you. Again, any further discussion or comment?
Mr.
Sorry.
Chair, I just wondered, and I apologize for being late to the meeting, so if I missed it, but I just wondered if any members of the Finance Committee had any additional comments on the reserve policy. I believe you stated that this was developed in conjunction with the Finance Committee. And I want to say thanks to the staff and the committee for working on this, because I know we've been talking about it for a while now, and I think it's an important step. But I just wondered if there are anything that those of us who don't serve on the Finance Committee should hear from Finance Committee members. Thank you.
No, great question. So we call on the Finance Committee members. Any comment?
This is Claudio, Mr. Chair. Happy to provide some context. The Finance Committee has gone through an iterative process, and we've been very pleased with some of the direction that we've asked the staff to do. One, take inventory of where there were any publicly available reserve policies from other exchanges. Obviously, that was our first instance. There wasn't a huge amount of information there, so we then expanded it to look at nonprofits, quasis. We particularly wanted to dig in and understand the vulnerabilities around a potential cyber attack and what our cyber insurance coverage would do and what additional vulnerabilities outside of that policy. That's probably one of the most likely anticipated scenarios where we may need to dip into reserves. And so there was a significant work on that particular body of work. I appreciate Holly's feedback and instruction to our subcommittee, our finance subcommittee, to understand what the policies currently cover and what still is sort of a vulnerability, even with that coverage. And then sort of the last direction that the Finance Committee provided was that we regularly look to benchmark so that we don't make this a one and done. And so you'll see as part of this final formal policy that every few years we do that due diligence and look again at peering to other ACA exchanges, other quasi-publics, and other state nonprofits. So I'm pleased to say that the board, the Finance Committee rather, after several conversations and a back and forth, voted unanimously to put this to the full board. I hope that answers some of your questions.
Yeah, thank you very much, Claudia. Helpful.
Terrific. Thank you. And thank you, Claudio, and thank you to the members of the committee. We have sorry, any other comments? we have a motion and a second, so I believe we're at a vote. Is that correct, Marcin?
Yes, Mr. Chair.
Then I'd ask for a vote to approve it, to approve the policy as presented. And this is Charles Klippel, yes.
Thank you. Paul Philpott,
Yes.
Grant Ritter,
Yes.
Deidre Gifford,
Yes.
Steven Hernandez, Matthew Brockman.
Yes.
Okay. And Mr. Brockman? Thomas McNeil,
Yes.
Lena Berlin,
Yes.
Andrea Barton Reeves,
Yes.
Kathleen Holt,
Yes.
and Claudio Galtieri.
Yes.
Thank you. Motion passes.
Again, thank you to everybody who worked on that. To Dr. Gifford's point, it's been an important issue that we've dealt with for a while now. Thank you. Susan, audit reports.
Thank you very much, Mr. Chair. Good morning, everyone. Susan Rich-Bai, Director of Legal and Governmental Affairs. I have an update for you all on our audit activity. Just to start with, Access Health CT is required to engage an independent auditor each year to conduct a financial audit and also a programmatic audit to comply with state and federal oversight and program integrity requirements. Whittlesley started a new engagement as Access Health CT's independent auditors in 2024 after an RFP process, and they are with us today for this meeting for any questions. Whittlesley completed the financial statements for Access Health CT for FY24 and also the programmatic audit that is required by ACA regulations for us as a state-based marketplace. These draft reports were presented to the audit committee last week on November 14th, and the committee voted to recommend approval of both reports by the board. For both of the reports, Whittlesley was engaged to express an opinion as to whether the basic financial statements are presented fairly in accordance with accounting principles generally accepted in the U.S. GAAP. It's referred to report on internal control over financial statements and compliance with the provisions of laws, regulations, contracts, and grant agreements in accordance with government accounting standards. Also report on compliance with the programmatic requirements that are set forth by CMS in 45 CFR Part 155. Those are our ACA regulations as a state-based marketplace. Whittlesley issued an unmodified opinion on the basic financial statements for FY24 and did not note any internal control findings. Likewise, no compliance findings were issued for the programmatic procedures as well. Jean Callan of Whittlesley is here with us today if anyone has any questions on the two reports. So I will pause, Mr. Chair.
Jean, thank you for joining us. And are there any questions or comments on the two reports? Perhaps following Dr. Gifford's lead, we could also ask any comments from the audit committee on the two reports. All right. Well, I appreciate that. Thank you all very much. I believe, Susan, you are asking us to vote to approve two statements. I'll let you state the vote, and then we will proceed accordingly.
Thank you, and I think Marcin has it. There are two. I think we split it up into two separate votes. The first one would be to approve the audited financial statements for FY24. And then the second one would be to approve the programmatic audit report for FY24 as well.
All right, so two votes. Let's start with the first one on the audited financial statements. Could I have a motion to approve those audited financial statements?
Yes. As a member of the audit committee, I motion to approve the audited financial statements for FY 2024. This is Grant.
Thank you, Grant. Second.
Paul, second.
Paul, thank you very much. I appreciate that. Any comment or questions? If not, then Charles Klippel, yes.
Okay, Paul Philpott,
Yes.
Grant Rader,
Yes.
Deidre Gifford,
Yes.
Steven Hernandez.
I vote yes.
Thank you. Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves, Kathleen Holt,
Yes.
and Claudio Galtieri.
Yes.
Thank you. Motion passes.
Second vote is for the programmatic audit report. Could I have a motion to accept that?
Again, this is Grant. Motion to approve the problematic audit report of FY 2024.
Thank you, Grant. Second?
Tom McNeil, All second.
Tom, thank you very much. Any questions or discussion? If not, Charles Klippel, yes.
Thank you. Paul Philpott,
Yes.
Grant Rader,
Yes.
Deidre Gifford,
Yes.
Steven Hernandez,
Yes.
Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves,
Yes.
Kathleen Holt,
Yes.
and Claudio Galtieri.
Yes.
Thank you. Motion passes.
Thank you very much. Susan, any further?
Yes, thank you. We just had one more audit report, if you will, to give you an update on. In addition to the 2 reports that we just went through, Access Health is required to complete an annual, what's called a SMART audit, which is the state-based marketplace annual reporting tool. So the ACA requires state-based marketplaces like Access Health to keep accurate accounting of all of our activities, our expenditures and receipts, and to monitor and report on all of this to U.S. Department of Health and Human Services. And we complete an annual report and engage an independent auditor, as we just discussed previously, to perform the independent financial audit and programmatic audit to ensure our compliance with all of the regulations and standards. CMS put all of this in 2015 into a tool, the SMART, to make it easier for state exchanges to provide all this reporting. So the SMART includes eligibility and enrollment policies. That's one of the things that questions are asked on. Our ability to collect and submit standardized performance monitoring data related to our qualified health plans that are offered, and also the financial assistance, the APTCs, and the CSR eligibility determinations, enrollments, disenrollments, and special enrollment periods, financial and programmatic audits, as we just discussed, our compliance with program integrity requirements, and then finally it concludes with an attestation of completion. So for this year, Access Health CT filed our SMART for plan year 2023. This is a little different than the other 2 audits. It's done in a plan year. We filed it on May 31st. The requirement was to have it in by June 1st, and on September 10th, CMS issued its SMART summary of observations and action items for Access Health CT, and they did not identify any action items for this SMART filing. I'm happy to report. So there's no vote needed on that, but we just wanted to give the board an update.
Thank you. Any questions or comments on the update? If not, thank you, Susan, and thank you to our audit firm and represented with us today. Appreciate all the effort. Thank you so much. The next item is an update on open enrollment 12. So please, if you would, Catherine.
Thank you, Mr. Chair. Good morning. My name is Katie Hearn. I'm the Associate Director of the EPMO at Access Health CT. I would like to give you a brief OE enrollment status update today. Our qualified health plan auto renewals are currently processing, with the final auto renewal notices going out to consumers next week, the week of November 24th. You can see there our projected auto renewal rate for the OE 12 period. As a reminder, we do have a public enrollment dashboard on the accesshealthct.com website, which is updated weekly. The enrollment projections below are for the end of the open enrollment period on January 15th, Those were shared at a previous board meeting. I've carried them over here. We're projecting more than 150,000 total qualified health plan enrollments. For Cover Connecticut alone, we're projecting more than 44,000. And for the standalone dental plans, we're projecting upwards of 14,500 individuals to enroll. Next slide, please. The purpose of this second slide is to show you where we were just prior to open enrollment last year and just prior to open enrollment this year. The first row there, just to clarify, refers to full cost QHPs. Overall, you can see we are beginning with much higher enrollment numbers prior to this year's open enrollment. And the Enhanced American Rescue Plan Act subsidies, the Medicaid unwind, and the Cover Connecticut program are all contributing factors to those increases. Next, please. And here we've captured the enrollment totals year over year. The open enrollment 12 enrollment totals here are captured as of November 15th. You can see enrollment increases across the board. The Cover Connecticut numbers are included in row 3. They're not spiked out, but the Cover Connecticut enrollment numbers as of November 15th for the 2025 plan year was 5,389. Auto renewals are continuing to process this week. They're not included in the totals here. So by next week, our enrollment data will include all auto renewed qualified health plans. Thank you very much for your time and attention.
Thank you. Great update. Appreciate it very much. Any comments or questions on Katie's update?
Yeah, Mr. Chairman, just want to comment on the impact Cover Connecticut has had on our enrollment numbers. In the past, we end the year about 110, 108, 120, 115,000. Then we start losing members. And by the third quarter, we're down to the mid-90s. This year, we continue to climb. The numbers just keep increasing month over month. And we ended the year close to 140,000. We know that's due in part, or large part, because of Cover Connecticut program that's run out of DSS, and so that has been very helpful to Connecticut residents and helping them to maintain their health coverage. Because some of that population, just a $10, $20, $25 a month premium may be too much for them to do month over month. So that has been extraordinarily helpful. And also the fact that they don't, the cost sharing is also covered. And that's also been very helpful in terms of managing their health needs, because they don't have to come out of their pocket. So I just want to put that out there, how helpful this has been to our numbers, but more importantly to Connecticut residents to manage their health and maintain their coverage. Because this is the highest number we've ever had in terms of enrollment numbers. And also, I know I mentioned it last month, this year we are projecting that we're going to be over $1 billion being brought to the state of Connecticut by way of advanced premium tax credit to help Connecticut residents to afford health insurance through the exchange. For the very first time, we're going to cross $1 billion.
Yeah. So, thank you. No, that's very helpful. I appreciate it. Dr. Gifford.
Thank you, Mr. Chair. I apologize for being late. I was having technical issues this morning. But I wanted to ask, for these numbers and James' comments about our good enrollment numbers, if there was a discussion among the board about planning for the potential expiration of the enhanced tax credits. Enhanced premium credits that we know there's a strong possibility may not be renewed. And if there wasn't a discussion, I'd just like to suggest that we begin that planning process and start thinking about ways that we can assist individuals or direct individuals who may be losing enhanced support at the end of next year.
So, Dr. Gifford, you glad you brought that up. That was going to be my closing comment. At the NASHP level, we have been discussing this over the last year. This is my colleagues across the country who are running exchanges. So we've had a work group communicating to elected officials to encourage them to make sure that they know the impact this would have on their constituencies. Well, what we've done in Connecticut, while Connecticut will be very supportive of keeping it going, but we have identified by district, by each congressional elected official, the impact. If this went away, this is what your constituents would have to pay out of their pocket going forward. Now, my colleagues are doing the same thing across the entire country, especially in areas where you have moderate Republicans who may be whose constituencies may be impacted by these enhanced subsidies going away. So, having said that, internally we are working to identify policies or laws that could be enacted in Connecticut to help support any impact that going away. That if the enhanced subsidies go away, impact that they may have on Connecticut residents, and what can we do as a state to insulate or minimize the potential impact that may have on Connecticut residents. So we are working very closely within the state among ourselves, and we're going to be working with the board to share a list of recommendations that the state, the governor, the state legislature could take to help the folks who may lose this coverage, and we will also attach a potential price tag to it as well.
Right. So maybe, James, we could get an update on that at an upcoming board meeting.
Sure.
The options.
At January board meeting, we will, but the state legislature goes into session in January 6th. So we do want to get this thing moving quickly. So we're moving very quickly and get the word out as quickly as possible. So we may have the list ready. When that happens, we may have a special board meeting or forward it to the board for their consumption and also give us feedback as well.
Okay. Thank you.
Right. But again, it's been a year-long process that we've been working collaboratively across the country to try to get these things restored as quickly as possible. At least keep them going, if not made permanently. And I'm hearing some positive stuff from my colleagues across the country.
James, it's an important issue. One thing that would be helpful, at least to me, would be some kind of quantification. How many people do you anticipate will be affected and to what extent? So if you have any numbers on this issue, that would be interesting, at least to me.
Yes, we do. We do. I mean, Charlie, just the 400% cliff, that would be devastating to that group alone. They wouldn't qualify for any subsidy at all going forward. And it's a low threshold. And if that gets reinstalled, you have a good chunk of folks who would not qualify for any subsidy at all, while others subsidy may reduce. So that would be really impactful to working class folks who are in need of coverage. And so we have all the data. We know what the numbers are. We know where they live. We know who's getting the benefits. So we can certainly run those numbers and get it back to you and the board.
Appreciate it. Thank you very much. All right. Any other comments or questions on the open enrollment? One comment from me is it's heartening to see the Cover Connecticut numbers reach the 40,000 mark. That's impressive. I remember in the early days, that was sort of the projected goal, or at least the projected reach of that program, and we were short of it by a significant amount. So it's great to see it reach there. I think we're losing a quorum, so maybe, James, if we could move right to an adjournment before we do.
Absolutely. Yeah, we're good.
All right. Thank you all very much. If I could ask for a motion to adjourn this meeting.
This is Claudio, so moved.
Thank you, Claudio. Second.
Don McNeil, second.
Perfect. Assuming no comment, Charles Klippel, yes.
Paul Philpott,
Yes.
Grant Rader,
Yes.
DJ Gifford, Steve Hernandez,
Yes, and thank you.
thank you. Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves,
Yes.
Kathleen Holt,
Yes.
and Claudio Gualtieri.
Yes.
Thank you. Motion
Thank you
passes.
all very much for your attendance today and
Thank you
your
much.
participation.
Thank you all.
Thank
Have
you.
a happy Thanksgiving, everyone.
Happy
Thank you, everyone.
Thanksgiving.
Yes, thank you.